our experience about IVF and the woman, the patient who is undergoing IVF, the 2-3 factors in our country is very important. One, of course, is the financial one, the financial burden on the patient and her family. Because you never know how many cycles will it take for her to have a baby. That's the thing. How many stimulations she will have. And second important is the compliance. Compliance regarding both psychological trauma of a failure and also the physical part, that is we talk less about, are the injections. And if you talk to our patients, we'll see one common apprehension or negative perception about IVF. तो डॉक्टर्स बहुत इंजेक्शन देते हैं, that we give a lot of injections in this, and to some extent this has been the truth. So over the time, see, there have been attempts to bring different systems of injection which become less painful. Say one example I can tell you, like progesterone injection. Earlier it's an oil-based preparation. Earlier it was an IM injection intramuscular. It was very painful. And now most of the companies have brought, they have added cyclodextrin along with progesterone. They have made it water soluble. Now we have aqueous progesterone, which is subcutaneous, which much more patient friendly than an IM progesterone. So that's one thing. Just similarly, people have tried with even oral antagonist, but has not been very popular. So for these two preparations, two drugs, you need to give a gonadotropin to the patient and also an antagonist injection, mostly because most of the cycles are out antagonists. So these two injections have become mandatory. So if we get a system where you get a needle-free injection system in NFIS, it will be really patient-friendly. Because the pain of the needle is very scary for the patients. And I have seen a lot of times patients don't want to undergo multiple cycles. They have understood, okay, I can go for another cycle, I can go for another stimulation. Scientifically true, we may not have success in one cycle, but that trauma of repeated injection. So if you have a needle-free system, injection system, I think that will reduce that physical part of the physical trauma to the patients. That will be really helpful. So this approach of NFIS will be a really nice one. And second also, we are using this, bioequivalent molecules of the original molecule of recombinant FSH. The original molecule was much more costly in India. So the Indian companies which came up with these biosimilar molecules from Intas and other pharma companies, that has helped us to cut down the price. As I mentioned, this financial burden is also important one. So from that part, this injection of Folisurge, if it comes in a needle-free injection system, that will be really beneficial for the patient, because it has similar efficacy to the original molecule in terms of an oocyte retrieval rate, M2 site, number of M2 sites we get, the good quality blastocyst and the pregnancy rate. They have been similar with the original molecule, and of course it is much cheaper than the original molecule, and if it becomes a needle-free injection system, it will be really helpful for the patients.